A hernia is a weakness in the abdominal wall that presents as a lump or a swelling. One of the commonest sites is in the groin. Over here you can see a lump that has come out and may contain intra-abdominal contents such as fat or bowel. The operation, which can be open or laparoscopic, robotic, the lump is pushed back inside and then the area reinforced, typically with a mesh, sometimes with suture. In this video we will examine the discharge process from the hospital and what is important, the important do's and don'ts once at home, and then dangerous symptoms to look out for after the operation. Once the operation is finished, patient is moved from the operating room to an anesthetic area where they recover, especially if the anesthetic is general anesthesia, and onto the ward. On the ward, they're encouraged to move around and to take oral diet and liquids. They're observed for vital signs being stable, such as blood pressure, pulse, temperature, oxygen saturation. The incision site is inspected regularly to make sure there is no undue bleeding. They are assessed for their ability to move around and walk freely. And finally, that they are able to void and pass urine without hindrance. Once these general criteria are met, then patients may be deemed suitable for discharge home. The discharge medication are typically dispensed. There are three main varieties: painkillers, anti-nausea medication, laxatives or stool softeners. Apart from that, patients are on prescription medication and their stocks are running low, then the discharge team may provide these as well. Patients are provided with discharge information that includes contact if things don't go to plan, information about their condition and do's and don'ts, and finally follow-up arrangements to be reviewed in the clinic by the surgeon. Once you're at home, it is important to control the symptoms, the most important of which is pain. Patients are given painkillers and they ought to take that regularly without waiting for the pain to come on. It is advisable to take diet help with constipation. The inactivity from surgery and the painkillers often cause constipation or make it worse, and it is advisable to take laxatives prophylactically in the recovery phase. If there is nausea, it is often related to the medication, and there are tablets available to control the nausea and sickness. There are no real restrictions on activity levels. However, the pain and soreness is the guide. It is okay to walk around, go up the stairs, and look after your day-to-day activities. Let pain be the guide about how much you can do, and it is much preferable to return to your normal level of activity earlier rather than later. Whether you have had an open operation as seen over here or through keyhole with 3 small incisions as shown over here, you will initially have a dressing on top and you can remove that 36 to 48 hours later, and you can take a shower at that time. Taking a bath or immersing yourself is not advisable for up to 2 weeks after the operation. So far as driving is concerned, the limitation here is whether you are taking medication that may alter your conscious level, whether the pain restricts your movements and your reflex times, as well as your ability to brake. Hence, in general, maybe up to a week before you can drive safely. However, this is very individual. There are no restrictions on having sex. However, as before with any other physical activity, is the pain and soreness which is the limitation. On an average, it takes between a week to 2 weeks before return to around 90 to 95%, and within 4 weeks there shouldn't be any lingering symptoms with a full return to normal life. The nature of this kind of surgery, however, means that it may take sometimes up to 6 months for the soreness and some discomfort to fully be relieved. Now let's look at some of the dangerous symptoms. If you experience these, then you should consider getting in touch with your healthcare provider. First are the general, and we will also look at the specific to those wounds. If you have unrelenting abdominal pain that is further away from the area of the surgery and it doesn't go away with painkillers you've been given, if your vomiting does not subside, if you develop a temperature that is higher than 38 degrees centigrade, that is 100 degrees Fahrenheit, if you experience lightheadedness, especially if it's associated with pallor, if you're unable to pass urine or have a proper bowel movement despite taking adequate medication or laxative, or if you experience significant side effect allergic reaction from the medication. In terms of symptoms that are wound related, undue redness, especially around the wound, or if it is spreading, or if there is discharge that is pussy and not clear and watery, if there is bruising that is enlarging or getting bigger, if there is bleeding from the wound site, there will be some staining of blood at times on the dressing. These waterproof dressings can be changed after 48 hours for fresh ones. If a bulge appears at the site of the operation, if there is undue testicular pain that is unrelenting, male patients may find that by using support garments such as the so-called jock straps, that might actually help with the normal testicular pain. And finally, if numbness appears around the wound site or where hernia has been repaired, this is not an emergency but may be indicative of a dysfunction in the sensory nerve, which mostly is temporary but sometimes permanent. Numbness in a limited area of the wound is not a cause for huge concern and may be brought up to the attention of your doctor in the post-operative visit. This completes this brief overview of recovery from groin hernia repair. If you have any comments, please do share, like and subscribe. Thank you.